Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained, episode number 95. I am your host, Marie Betcher, RN. This is going to be a replay of episode number 20, when to call the nurse and when to call the hospice team. I just want to add a little bit of information to this episode. You can use Medicare.gov to help find a hospice agency. So you're going to start at Medicare.gov, then choose Find Provider, then choose Hospice, and then you're going to put in your zip code. This should give you a list of local agencies. I want to encourage you to listen to the rest of the replay of episode 20. And if you need to find a hospice agency, for more information, Dr. Keshana Guidry, who is also a podcaster, I interviewed Dr. Guidry on episode 88 of Hospice Explained. Dr. Guidry's podcast is Dr. G at the Heart of Healthcare. On Dr. G's episode number 36, Dr. G interviews Nurse Gerard. They discuss how to find a hospice. They discuss multiple reasons to choose one over the other. I really encourage you to give it a watch or a listen. I will add links to both of these in my show notes. And finally, I want to mention that I'm not going to do ads on Hospice Explained, but I am going to have affiliates. I now have 3 affiliates. If you use one of the links, Hospice Explained will get a small commission. So please and thank you. My affiliates are with the Death Deck and the EOL Deck, helping you start conversations that matter. Also, Casey Giconio has started a Death Doula School, which is a comprehensive program that will empower you to make a profound difference. And finally, DNA is Love is offering Hospice Explained listeners a 5% discount. They have a menu of customized DNA-filled products for your loved ones and pets. Thank you, listeners. I appreciate you. And here is the original episode number 20. Hi, and welcome to Hospice Explained. I am your host, Marie Betcher, RN. I have over 30 years' experience as a registered nurse, and my goal is to decrease fear and increase education regarding hospice and the end-of-life season. On today's episode, I'm going to talk about when to call the hospice team for help. This can be interpreted in 2 different ways. The first reason to call the hospice team is to start hospice. Remember, hospice is for the last 6 months of life. If you or a family member has been told by your doctor that there are no more curative or treatment options available, then it might be a good time to call hospice. First of all, start by researching. May be simple to do an internet search. What are the hospice choices in your area or the area where your loved one lives? Another idea is to call around and talk to the hospices directly. Find out what they have available, what their resources are, and see if they might be a good fit for yourself or your loved one. Also consider calling someone who you know that has already had a loved one on hospice. Ask them questions. Find out what went well, find out what didn't, and get their opinion of what company might serve your loved one's needs. I do not recommend just taking one person's word for it. I recommend getting multiple suggestions. Hear from as many people as you can possible and do your own research. One person may have a negative report, but their report may not be accurate if they did not do any research and had unmet expectations, meaning they didn't know what to expect or expected something that wasn't even realistic. With unmet expectations are often one of the most difficult to overcome. We expect a situation to go one way, and when it doesn't, it can make you feel very angry. My recommendation is to research, to understand the situation, to understand what's coming, to understand the end of life. and what might be the best option for your loved one. Don't just call one hospice if you have multiple available. Call multiple ones. Then you can choose, knowing you did the research. You can also stop after you talk to people and then talk to several family members and your loved one who's dying. And hopefully your family member can help you make the decision for which to choose. Now, the second part is when to call the nurse for questions when your family member or loved one is already been admitted to the hospice team. Hospice will provide a phone number for you to reach the on-call nurse. The admission nurse is going to get you set up with supplies, equipment, if not already done by the intake nurse. You should know when your next visit will be, or you'll be getting phone calls within 1 to 2 days of admission, and various team members will be reaching out to you. The admission nurse will also commonly discuss medication, for instance, comfort medication, and either have an order and a plan to get some, or you should know how to reach out to hospice and get these medications. Please remember to think about getting refills, equipment, or supply needs taken care of several days in advance. Think about weekdays. They are the easier time to get the most things done, refills, supply needs, etc. During the admission process, your family member or loved one will receive paperwork. This paperwork is going to have information regarding the end of life. This paperwork will often talk about the changes that I've discussed in this podcast. It may discuss other items that are not in this podcast. You are already ahead of the situation because you are listening to this podcast. Please take time to read the information. It always helps to be proactive. Being proactive will help you not run out of medications, supplies, or have equipment needs that need to be changed on evenings, nights, weekends, or holidays when it can take a lot longer to get done. I'm going to list several things that can be reasons to call the nurse. Uncontrolled pain. Anytime pain is not being managed, please call and discuss the situation with the on-call staff. Shortness of breath that is not being managed by positioning, possibly oxygen supplementation, or medication that can help ease the symptoms. Call the hospice team. One of the most frequent calls hospice teams get is for terminal agitation. Remember, this is a period of time where the patient's body is telling the brain something is very, very wrong. This is when patients need to be very carefully monitored. They may be trying to get out of bed. They get very restless and agitated. Safety is a priority. Make sure they are safe, they don't get out of bed or without the proper assistance. Also during this time, they may not be alert and oriented where they previously could talk to you. Hospice can make recommendations on safety and potentially medication. You or your loved ones absolutely call hospice. If your family member or loved one that is on hospice has an IV, which is inserted into a vein, it could be a port inserted in their chest, and there is any redness, warmth, swelling at the site, always call hospice. If the medication that is being delivered into this IV site is not giving relief, call hospice. If you're out of medication, please always remember to plan 1 or 2 days at minimum in advance to get your refills, especially if your family member or loved one is going through the medication faster than anticipated. If for any reason the pump that delivers the medication is failing, beeping, and not responding to what you've been taught, absolutely call hospice. There are multiple other types of drains, catheters, that may need to be emptied or could be blocked or plugged. Always call if you have a question regarding drains. The whole goal of hospice is to help with these conditions that make patients uncomfortable. There could be a mechanical question. A mechanical question could be the bed's not working. Hospice can get that company to bring out a new bed, whether it's in the evening or the night, and if it's not an emergency, then maybe they can just plan to do it the next day. Other problems could be simply wound care, and a dressing needs to be changed, or, again, more supplies need to be ordered. There are plenty other reasons that you may need to call. My goal is to help you decrease fear and improve your education and understanding. But I really want to encourage you to be proactive and get supplies, medications, equipment problems managed weekdays when the hospice team is all available and changes can be made a little faster. Hospice is going to do their best to help yourself and your loved one no matter when you call. Please try to write down your questions, or, for instance, if you know you're going to be needing briefs and wipes and your nurse is coming tomorrow, write down a list. Your nurse is going to ask you what supplies you need, going to ask you what type of medications you need refills on. That's a perfect time to talk about it. But if your nurse visited 2 days ago and you don't expect to see your nurse for another week, please by all means call the hospice team. They can help you order more supplies, equipment, or medications, or they can send out another nurse to do an in-between visit. Sometimes those are needed. And if it's after hours, sometimes the night nurse can come out and visit. For example, again, when we were talking about that plugged catheter, the night nurse may need to come out and change catheters, put in a new catheter in the bladder to help that drainage, to keep your loved one comfortable. And if it's the port or an IV, they may need to come out and deaccess and reaccess the port. If the pump's not working, the nurse may need to come out, bring out a new pump, and get it working. I know I haven't mentioned every reason why you might call a nurse, or every reason why you may need social work, chaplain, etc. The goal of this episode is to help you think about when you may need to make a call to the hospice team. They're there for you to call. That's the whole purpose. So don't be afraid to call. If you have a suggestion or story that you would like me to discuss in a future hospice episode, please email me, Marie, Marie, at hospiceexplained.com. I'm going to dedicate today's episode to Kathleen Flanagan Bruner. She is one of my family members. She was a young woman and died suddenly. I think with all people that we love, the one thing we wish is we had more time. I'm grateful I had the chance to talk to her just a couple days before she died, loved by myself and our family, and we know she loved us. Thank you for listening to Hospice Explained. Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.